would turn medical ethics completely on its head. It's really interesting, even in the Hippocratic Oath, where I think there is a huge wisdom and recognizes that you need to have a very clear boundary around medical care, because it is a situation where there's a fundamental imbalance of power between a doctor who has the power and the knowledge and the patient who's in a vulnerable position. So that's why we have to practice medicine within clear ethical frameworks to avoid any abuse occurring. And in the original Hippocratic Oath, it actually said that a doctor must never administer or attempt to procure a medication to harm somebody or to end their life. So I think there's been a recognition that euthanasia is probably not a great thing to bring into medicine. But on the point of informed consent, I worry that people are not actually informed as to what this death will look like. So the bill's very clear. It is suicide in the sense that suicide means taking your own life at your own hand. The doctor cannot, with this bill, actually administer any medication. But there is no guarantee that this death will be quick or painless. And in fact, I was reading a paper of the Association of Anesthesiologists or Anaesthetists, and there's quite a high incidence of vomiting after these drugs, which are unregulated. There's no sort of set concoction. There's no, different countries use different cocktails. People react really differently to drugs. So you may get a quick, swift death. But about a third of these deaths take between 90 minutes and 30 hours. And according to the bill, if you're following the bill, the doctor is not allowed to step in to help you if things start to go wrong, because they are then colluding. I mean, I haven't had a lawyer say to me that is not the case. So reading the law at the moment, it looks like you're on your own once you take those pills or that concoction. And if something goes wrong, if you're unconscious, then come round. If you are in pain or if you're suffocating and you can't cope, the doctor can't help. Whereas in a hospital, if you were, having palliative care and your pain or your breathing difficulties get worse, the doctors are able to give you help with morphine. So I think we have to have informed consent around what this death actually looks like. I think it will always be a violent act to take your own life. And I think to try to pretend that in a clinical environment that is, you can kind of sanitize death is naive.